Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Comparison of D-dimer concentration and thromboelastography for diagnosis of cerebrovascular accidents in dogs, a retrospective study. A stroke or cerebrovascular accident CVA may be ischemic or hemorrhagic. To diagnose CVAs in veterinary patients, advanced imaging such as magnetic resonance imaging MRI is required. Ischemic strokes demonstrate well-demarked, T1 weighted, T1W hypointense, T2 weighted, T2W, and fluid attenuated inversion recovery flare hyperintense lesions on MRI. Within 24 hours of onset of clinical signs, ischemic strokes appear hyperintense on diffusion-weighted imaging DWI. Hemorrhagic strokes change over time as hemorrhage progresses from oxygenated to deoxygenated blood, and may appear as a signal void on T2W gradient echo GRE or T2 sequences. D-dimers and thromboelastography TEG have been used to diagnose CVAs in human patients, but their role in diagnosing CVAs in animals is limited. This study aims to assess the sensitivity and specificity of blood D-dimer concentration and TEG for supporting an MRI diagnosis of CVA in dogs, and to evaluate whether these tests can differentiate ischemic from hemorrhagic strokes. It is hypothesized that D-dimer concentration and TEG will be abnormal in dogs with CVA and will be more likely to be abnormal in cases of ischemic stroke. Materials and methods. A multi-center retrospective case control study was undertaken to evaluate two groups of dogs for cerebral vascular accident. Medical records at the University of Wisconsin, Madison Veterinary Medicine Teaching Hospital and Ordell Animal Hospital in Paramus, New Jersey were searched between August 2015 and May 2021. Dogs that underwent brain MRI, as well as testing for blood D-dimers or TEG were included in the study. For inclusion in the study, dogs had to present neurological deficits or a history of neurological signs such as seizures or suspected transient vestibular syndrome, in addition to having undergone a complete MRI study of the brain including both transverse and sagittal sequences. The MRI criteria for suspected ischemic stroke included a focal or well-demarcated T1W hypointense, T2W, and flare hyperintense lesion with variable contrast enhancement. Dogs were included in either the D-dimer or TEG cohort based on the testing that was performed and then included in one of two subgroups based on their imaging findings. Medical records of each case were reviewed from both institutions with all relevant data, including age at the time of MRI, sex, breed, neuroanatomic localization according to neurologic examination, onset of clinical signs, MRI findings, CSF analysis when available, and D-dimer or TEG results or both collected. MRIs were performed under general anesthesia using one of three magnets, 1.5 T Siemens Avanto, 1.5 TGE Healthcare, and 1.0 TGE Medical System Cigna Advantage. The TEG analysis was performed at the University of Wisconsin, Madison Veterinary Medicine Teaching Hospital. Plasma D-dimer concentrations were measured by a commercial laboratory through latex agglutination. Dogs that presented with any encephalopathy other than CVA based on MRI findings, progressive neurological signs, and cerebrospinal fluid analysis were included. In Group 2, the control group, dogs of any age, breed, or sex were considered for inclusion, even those with spinal cord imaging, as long as a complete brain MRI study that included both sagittal T1W, pre- and post-contrast, and T2W sequences, transverse T2W flare, transverse T2, and transverse DWI that was associated with an ADC map had been performed. The reference range for normal CSF total nucleated cell count, TNCC, was less than 5 cells, and normal total protein concentration was less than 30 mg/dl for cerebellomedullary cistern collection and less than 45 mg/dl for lumbar collection. Results consistent with hypercoagulability were a shortened R, less than 3 minutes or K, less than 1 minute, or increased alpha angle, greater than 74, or MA, greater than 70 millimeters. Results consistent with hypocoagulability included prolonged R, greater than 9 minutes or K, greater than 6 minutes, or decreased
Micro alfa.
angle, less than 34, or MA, less than 40 millimeters. Previous studies have validated the use of D-dimer concentration and TEG in dogs. The medical records were reviewed, and collected data included age at time of MRI, breed, sex, neuroanatomic localization at the time of admission based on neurologic examination, onset of clinical signs, MRI findings, CSF analysis results when available, and D-dimer or TEG results or both. The sensitivity and specificity for abnormal TEG or abnormal D-dimer concentration for diagnosis of a CVA were calculated, and 95% confidence intervals. Results. This study included 68 client-owned dogs which met the inclusion criteria. Group 1 consisted of 40 dogs and 28 dogs were in Group 2 neurologic control. D-dimer concentration was measured in 35 dogs, while TEG was performed in 34 dogs. One dog from Group 1 underwent both D-dimer concentration and TEG. The demographic information is presented in Table 1. D-dimer results. Population data. 35 dogs underwent blood D-dimer testing. No significant difference was found between neurologic controls and dogs with evidence of CVA concerning the timing of blood collection in relation to the onset of clinical signs, or the time between onset of clinical signs and MRI. There was also no significant difference between dogs with evidence of CVA and neurologic controls regarding the patient's sex or age. Out of the 22 purebred dogs, there were 2 of each of the following breeds: Labrador Retriever, Toy Poodle, Maltese, Yorkshire Terrier, and Pug. There was 1 dog each of the following breeds: Golden Retriever, English Bulldog, Beagle, Miniature Schnauzer, Airedale Terrier, French Bulldog, Soft-coated Wheaten Terrier, Cavalier King Charles Spaniel, Jindo, Cairn Terrier, Dutch Shepherd, and Miniature Pinscher. 13 dogs were mixed breed. Prosencephalon, N equals 20. Central vestibular system, N equals 11. Multifocal brain, N equals 2, and peripheral vestibular system, N equals 1. were the neuroanatomic lesion localization based on the neurologic examination. One dog had a history of collapse episodes not consistent with cardiac disease or seizures. The prevalence of CVA in this cohort of dogs having D-dimer testing performed was low, 13/35, 37%. Group 1, 13 dogs. 4 out of 13 dogs, 30.8%, with MRI evidence of a CVA had increased D-dimer concentrations. Among the 8 dogs diagnosed with ischemic CVA, 3, 37.5%, had an abnormal D-dimer. Among the 5 dogs diagnosed with hemorrhagic CVA, 1 had an abnormal D-dimer concentration. Abnormal D-dimer concentration was not significantly associated with classification of ischemic or hemorrhagic CVA, p equals 0.43, table 2. An acute onset of clinical signs occurred in 92.3%, 12/13, of dogs. 10 dogs, 76.9%, had D-dimer testing done within 1 week of the onset of clinical signs. Cerebrospinal fluid analysis was performed in 4 dogs, table 3. Group 2, 22 dogs. 3 out of 22, 13.6%, dogs in the neurologic control group had increased D-dimer concentrations, and 19 of 22 dogs, 86.4%, had normal D-dimer concentrations. Cerebrospinal fluid analysis was performed in 14 out of 22 dogs. Table 3. Sensitivity and specificity of D-dimers. In this low-risk population, CVA prevalence, 37%. The sensitivity of D-dimer concentration for CVA diagnosis was 31.1%. 95% CI, 10% minus 61%. And specificity was 86.4%, 95% CI, 64% minus 96%. Table 4. TEG results. Population data. 34 dogs underwent TEG. No dogs had TEG results that suggested hypocoagulability, and therefore all results defined as abnormal refer to evidence of hypercoagulability. There was no significant difference regarding patient age or sex between dogs with evidence of CVA and neurologic controls. Out of the 29 purebred dogs, there were 4 Labrador Retrievers, 3 Weimaraners, 3 Shih Tzus, and 2 each of the following breeds: Yorkshire Terrier, Miniature Schnauzer, and Welsh Corgi. There was 1 dog each of Toy Poodle, Beagle, Soft-coated Wheaten Terrier, Alaskan Clay Kai, Chihuahua, German Shepherd, Golden Retriever, Shetland Sheepdog, Border Collie, Shiba Inu, Siberian Husky, Brittany, Spaniel, and Greyhound. 5 dogs were mixed breeds. Central vestibular system, N equals 13, prosencephalon, N equals 10, multifocal brain, N equals 5, peripheral vestibular system, cerebellum, brain stem, T3, L3 myelopathy, C1, C5 myelopathy, and normal neurologic examination, N equals 1H, were the neuroanatomic lesion localization based on the neurologic examination. The prevalence of CVA in this population of dogs was high, 28 for 34, 82%. Group 1, 28 dogs. 28 out of 34 dogs, 82.4%, with TEG, were in Group 1. Of these, 18 dogs, 64.3%, had abnormal TEG. Of the 12 dogs diagnosed with ischemic CVA, 66.7%, 8/12, had abnormal TEG. Of the 16 dogs diagnosed with hemorrhagic CVA, 10, 62.5%, had abnormal TEG. Abnormal TEG was not significantly associated with classification of ischemic or hemorrhagic CVA, p equals 0.40. Cerebrospinal fluid analysis was performed in 24 out of 28 dogs. Table 3. Group 2, 6 dogs. 2 out of 6 dogs, 33.3%, had abnormal TEG. Cerebrospinal fluid analysis was performed in 4 dogs. Table 3. Sensitivity and specificity of TEG. In this high-risk population, prevalence of CVA, 82%. The sensitivity of TEG was 64.3%, 95% CI, 44% minus 81%. And the specificity was 67.7%, 95% CI, 24% minus 94%. Table 4. Discussion. This study found that blood D-dimer concentration and TEG alone cannot be relied upon as diagnostic tools for MRI-confirmed CVAs in dogs with neurologic disease. However, a positive D-dimer test result may be useful as a screening test because of its specificity in a low-risk population. In contrast to human medicine, blood D-dimer concentration in dogs has been shown to be most useful for systemic diseases and thromboembolic conditions, rather than CVAs. This study has demonstrated that D-dimer concentration has limited use as a screening test in dogs with clinical signs consistent with CVA. If a positive result is obtained, further diagnostic testing such as MRI may be necessary. This study was unable to assess for an association between hemorrhagic CVAs and hypocoagulability using TEG, as no dogs had TEG results consistent with hypocoagulability. Furthermore, this study found that neither an abnormal blood D-dimer concentration nor TEG was significantly associated with a CVA diagnosis when comparing ischemic to hemorrhagic strokes. Although MRI has high sensitivity and specificity for detecting intracranial lesions, differentiating CVA from neoplasia or other parenchymal diseases is not always possible. Being able to distinguish among intracranial disease processes is important because treatment options and prognosis vary markedly among different pathologies and are likely to influence owners' decisions for continued treatment versus euthanasia. Future prospective studies are recommended to evaluate MRI, TEG, and D-dimer concentration using blood and CSF samples in patients with suspected strokes. Biomarkers are wanted to increase the accuracy of CVA diagnosis and provide alternative options to advanced imaging for diagnosis of CVAs in veterinary patients. This study has limitations, including its retrospective nature, different study populations, a small sample size, and that only 1 dog had both D-dimer concentration and TEG performed. The test selected was based on availability at participating institutions, and the timing of tests in relation to the onset of clinical signs varied, which could have affected the test results. Furthermore, no dogs had histopathologic confirmation of the diagnosis, and the inclusion criteria precluded enrollment of all patients with suspected strokes. In summary, blood D-dimer concentration and TEG alone cannot diagnose CVAs in dogs with neurologic disease. Although a positive D-dimer test result may be useful as a screening test, future prospective studies are needed to further evaluate these diagnostic tests and to identify other biomarkers that may increase the accuracy of CVA diagnosis. Differentiating CVA from other intracranial disease processes is important, as treatment options and prognosis vary among different pathologies, and it is likely to influence the owner's decisions for continued treatment versus euthanasia.